It's the Practical Medicine Podcast again.
With Rob Balko.
And Stephanie Lipnicki. And we're going to talk about stroke this evening. And we just want to remind everyone that it is our goal to bring awareness about many different ways to maintain health and heal your body, mind, and spirit, from acupuncture to Zen living and everything in between. So this is podcast number 4. And initially we were going to try and cover stroke and traumatic brain injury, but there is so much information just about stroke alone that we wanted to share. So we felt like we would, rather than rush through either topic, we'll focus on stroke tonight, and then we'll push out the traumatic brain injury stuff for another night, and we'll cover that. We just don't know when yet, so just anticipate at some point in the future you'll get to hear us talking about traumatic brain injury. Right. So this is Dr. Rob's specialty. He specializes in neurological conditions. In addition to stroke, what are some of the other neurological conditions that you cover?
Alzheimer's, Parkinson's, MS. And the traumatic brain injury, concussions, things like that.
Those sorts of things. Yeah. And how did you get involved with specializing in neurology? Is it something that you started back in school, or was it post-school?
It actually started before school with some family members getting strokes many years ago. And back then the prognosis was never good. There wasn't a lot they could do for people. And from there, it was rekindled in school with acupuncture. And some of my earliest patients were stroke patients who came to me, hey, can this help? We've tried everything else. I tried or used the traditional scalp acupuncture points that we've all been trained as acupuncturists, but unfortunately got very limited results. Within 24 hours, you need to be treated for a stroke. Otherwise, the prognosis is not very good. Okay. And so what I found was in 2012, there was a trip going to China that covered stroke, and not only stroke, but stroke in a stroke specialized hospital in China, which I came to find out is the way they do things in China. Is the whole hospital is focused on stroke and brain injuries and paralysis, neurological issues. So there's a lot of cross-pollination of different people working on it and studying it. And this Dr. Shi, which really founded the hospital, was the pioneer in this rather unorthodox way of treating strokes with acupuncture rather than using the traditional scalp points that we would normally use.
Right.
Okay. Considered pretty unorthodox for his time, right? So.
And you were saying it's relatively new. Like when we think of acupuncture being, they say there's different records. Some say 5,000 years, some say 2,000 years. You were saying that this particular way of treating is fairly new. It's like a baby in terms of treatments, that it's only about 50 years old.
That's correct. About 50 years, maybe a little longer. And at the same time, taken from the traditional acupuncture lineages in China at the time.
Okay.
It gets in, the history really gets into a little bit of the Cultural Revolution and closing down some of the more esoteric acupuncture styles, but Dr. Shi was able to keep some of that and bring it into the hospital.
Okay.
And inculcate that into this treatment. Okay. And then the next thing that happened was a colleague of mine, one of my teachers really, Dr. Shi, who is on the Upper East Side of New York. He was born in the United States, ethnically Chinese, I guess you could say. Went to China for 2 years and studied with Dr. Shi, and was able to really absorb that style in depth and bring it back to the United States. And what he does now is he holds classes and trains us, the rest of the United States and even other parts of the world, in the style, because he was able to absorb so much of the way Dr. Shi was.
Well, yeah, in 2
studying,
years you get a lot of that experience versus a lot of times the trips like that schools hold are only a couple of weeks long, sometimes a month. I had classmates that I think studied in China, not necessarily stroke, but studied for like a month. But if you're there 2 years, you're getting a lot more of it. And so how long have you been studying with Clayton?
About 3 years.
Okay.
Right. So he'll have classes on the specific issues, right? So we've got extremity problems, paralysis, and the ability of the hands to grasp or the feet to pronate when you're walking up a set of stairs, gait and things like that, aphasia, speech, swallowing, and other things that affect the neck region, for example. And then even working on cognition and speech, getting that person to come out from this closed down condition that they're in.
Right.
So,
and you've in addition to training with Clayton, you were saying that you've shadowed him and assisted him now because you've trained.
That's
for
correct.
A while with him.
I guess it was last spring. I was fortunate enough to go to his office on the Upper East Side and support him in treating his patients, do some moxa on the patients, maybe do a little bit of needle manipulation, something like that. But really to observe him and watch him be with people. And that really fills out the rest of the treatment is how you communicate with someone. The rapport and the connection and the importance of trying to reach that person who's kind of been closed off from the world by their inability to communicate, whether it's physically or with speech.
Right. So just back to a point that you made before that, the prognosis being like you really want to start within 24 hours of treating someone, but from what it sounds like, even if it's been more than 24 hours, you're still able to break that barrier and help that patient, even if it's been a significant amount of time since the actual stroke occurred and make progress.
Right, yep. In one of the case studies we'll get into, the patient hadn't come to me for many months before treatment. In the movie that we'll talk about, where the stroke victim's brother chronicled his journey. Had spent 3 months in the U.S. doing physical therapy and various other modalities. So it was
a bit of time before he actually found acupuncture.
Before he got to acupuncture. And then there's even a story that Dr. Shu told us where the couple just couldn't make appointments and they really wanted to travel and enjoy their lives. And they were willing to have a limited improvement, came back months later, and after a few more treatments, still improved dramatically.
Great.
So it's a different kind of treatment from what we as acupuncturists are used to, and it's a different kind of treatment that patients are.
Right. Which I think is good for anyone listening to hear, because someone that they love may have had a stroke and then think, well, okay, it's way longer than 24 hours. It's been a year. To know that
there's
could come
nothing
and
more
see
that can
someone,
be done, right?
Yeah, or that they're told nothing more can be done, that this is another option to make progress, and that even if it's small things like they can't grip something and you can make that change and then they can hold their fork, let's say, or their spoon so that they can eat. Talk to me a little bit just for the listeners about the definition of what's considered a stroke.
Okay. So a stroke is really any damage to the brain or spinal cord caused by an abnormality of blood supply.
So something shifts in it.
In one case, it's a loss of blood flow, or in another case, it's a brain bleed. And in the loss of blood flow, it's called ischemia, and that's the most common one. About 78% of strokes are ischemic strokes where the blood supply has been choked off, probably by a blood clot, and now the brain is being starved. And one of the things that happens is part of that tissue may die off, but then one thing that has been determined or discovered through imaging is part of the brain will shut down, or go into like a hibernation, or in a standby mode if in the computer world. As surrounded by computers here.
So it's there. It just needs to be restarted.
Right. It's protecting itself. Much the way other parts of our body protect themselves, and other injuries that we're used to treating. And in the other case of a bleed, now the blood is damaging the tissue because blood's not supposed to be in the brain, right? We have a blood-brain
barrier, the BBB.
Right. So that's another set of problems. But really, essentially, for our purposes of this discussion, we're talking about the same thing: is damage to the tissue. So, which impedes function, and we're trying to get that function back to the extent that we can. Okay.
And what are some of the problems that these patients have after the stroke.
It can be in this area of the throat. So, we've got a paralysis there. We're losing our ability to swallow, to speak, or to form certain words. Right? The brain can knows what it wants to say, but the tongue and mouth aren't saying those things.
And isn't there a component sometimes where the patient might think something but say another word? So there's different types of ways that the speech itself is affected.
Sure.
Yeah.
And then moving down the body, we have the arm, grasping, holding items, steadying yourself, walking, your gait. And the feedback that's going back to the brain is getting mixed up. So people wind up what I call serpentining down a hallway. And I'll take video of them on intake and then in a few weeks to see that progress. And you'll see them constantly heading off in one direction or the other, or they're heading off in one direction and then they correct themselves by coming back. And then again, they're still heading
listing
off.
Kind of to one
listing
side.
to one side.
Okay.
In some cases, it really is. They are really crooked that way.
Okay.
But in their mind, they're as straight as they can possibly be.
Right.
Right. Okay. So, sometimes you don't notice it so much, but as practitioners, we see that because when you look at something like that all day, you
can
start
pick it
to
up
pick
quicker.
up on that slight little difference. Like the way you might see someone's trapezius is a little higher than the other one,
Right.
or you doing aesthetic work, you might see
Differences in the face.
structural differences,
Yeah.
muscular differences, things like that.
Right. So let's talk about some of the statistics about stroke, because I don't know that people will realize just how,
Pervasive.
yes.
Epidemic, possibly.
Yes, yeah.
One of the big things that isn't really listed in what we're talking about here is, but as an overview, is in, say, 2017, 2018, stroke was listed as a number 4 killer in the United States. And it's in second place now, and it's very quickly going to be number 1. And the original projections were that it would be the number 1 killer by 2030.
Okay. And it moved that fast.
And it's moved that fast, right? 1 in 6 deaths from cardiovascular disease are due to stroke.
Okay.
Okay. And a stroke occurs every 40 seconds in the United States. Every 40 seconds.
Yeah.
That's 2,160 a day.
So
It just boggles the mind.
which in when we were chatting about this, put it into perspective that, so in Allentown and Upper Freehold, which is the immediate area surrounding my clinic, so my clinic is in Allentown. I don't even think Allentown itself has more than 900 residents, and then Upper Freehold has maybe 4,000 residents. So you're talking about more than the entire population of the town where my clinic is in, or half the population dying, not just having a stroke, dying from a stroke.
Every day.
Every day.
Right.
Yeah.
Yeah, it's a little skewed to say it's a town, but it helps you get perspective of the number
Right.
of people, but then to see it every day. So in any given day,
Right.
part of a small town disappears from the
Yeah.
United States
Right.
from a preventable condition,
Right.
right? Or I don't know if you want to call it a disease or not. But every year, almost 800,000 people have a stroke, and 610,000 of them, so most of them, 6 out of 8 strokes are first-time strokes, right? And they're happening younger and younger in people.
Right.
This used to be, an old
old
person
person's.
disease,
Right.
where someone 65 plus might get them, but now we're seeing them at any age, really, at any age. But we're seeing them consistently in the 50s and 40s now.
So younger and younger.
Yeah, yeah. And 1 in 4 strokes are with people who have already had one.
Okay.
Okay, so the chances of you having another one are pretty good if you've already had one.
Okay.
So just a quick note on the hemorrhagic strokes, the brain bleed, that can happen coming up into the neck and the carotids, the subarachnoid area. There's an artery that runs around the base of the skull that can happen. It can be inside the brain. It can be between the skull and the brain. There's lots of different places where that
And
can
see,
happen.
when you think of like testing, like you should have this test at this age and this test at whatever age, they aren't normally doing the ultrasound of the carotids until you're like into your 60s. So when you're talking about
Maybe
people
later.
having them younger and younger, should we, should Western docs then be testing the carotid arteries sooner? Is it something that should be part of more like, and I know insurance companies don't want to pay for anything. So, it's like, but it sounds like it might be something that should be tested a little bit,
Right.
Right.
And that falls under prevention.
Right.
And the big question is, how much prevention do you do? Right.
Right.
And we've seen in our experience, the medical community change their mind, right?
Yeah.
And they say, no, you don't have to do a breast exam before
Right.
this certain age, or you don't need colonoscopies before this, or they should only be done every 5 years and things like
Right.
that. And a lot of that is economic,
Right.
right? So it's hard to say. My answer to that is take better care of yourself, right?
Right.
Is be proactive. It's easier, right, to dig a well when you're not thirsty than it is to try and dig a well when you're
Right.
thirsty.
When you already
right?
are.
Right?
And strokes are costly.
Yes. The in 2014 and 15, the stroke-related costs in the U.S. came to nearly $46 billion. I wish I had a $46 billion thing I can compare that to, because that's,
Right.
That's an incredible amount of money. And that includes the health care, the medicines, and the missed days of work. So,
Right.
all that productivity.
And then comes into play, like when you talk about it being a long-term disability, the person who, let's say they are 40 and it's a severe stroke and they can't go back to work. 40 is very young to have to be on long-term disability in terms of, cost for life. And,
Exactly. And that's a big part of it.
right.
And how many people plan for long-term disability?
No.
Right?
No.
They think, or they're too busy paying their other bills to worry about that.
Right.
Another cost is stroke reduces mobility in more than half of stroke survivors age 65 and over. So now they're not able to not only maybe contribute to the workplace, they can't really enjoy themselves and their family
Right.
because they've been immobilized in some way.
Right.
Right? They can't enjoy their grandchildren by playing with them, maybe wandering around the playground, or maybe they can't cook for themselves.
Yeah, I was just
Right.
going to
They
say,
can't dress
just simple
themselves.
tasks that you would do day to day
Right.
that we all, take for granted that we're able to do.
Right. So certainly their quality of life has been diminished.
Right.
In the very least. Right.
So, and another thing that comes into play, and race and ethnicity becoming a part of it, and access to care. Like when they say that those first 24 hours are the most critical, that the risk, you were talking about the risks being higher amongst African American populations and
It's actually twice as high.
twice as high.
Right. The numbers are double for African Americans.
Right.
And they have the highest death rate due to stroke of any ethnicity.
And again, I keep thinking, are they not getting, when we were chatting about this, not getting the care? Like there isn't someone there who knows the signs to look for. They don't get to the hospital in time, and therefore, their chances of survival are lower.
Right. Yep. Yeah. A big, if you go to the CDC website and you look at the map, and it's glaring how stroke prevalence goes from Texas to Georgia in the south, and almost stops dead above at Tennessee. So it's really prevalent in the south, and the south is fairly rural. So how long is it taking
To get to the hospital.
an ambulance or the family? Maybe the family puts them in
Right.
a car and drives them to the hospital.
Yeah.
And then what are the odds that that hospital has the capability to handle a stroke?
Right.
In a rural county,
Yeah.
say, in the middle of Alabama. So you can see why these numbers might be higher than,
Right.
say, in an urban center
Yeah.
where there's a regional trauma center.
Yeah, like we're so close to New York and Philly, like we have access to the
Right.
best hospitals, best doctors for just about anything that goes wrong.
Right. And they can be medevaced from one
Right.
place to another.
Yeah.
Right, is Jersey Shore right here has we actually have a second now helipad
Okay.
for any accident out on the highway. they're going to medevac that person immediately to the hospital and give them, the best care they can get. There's actually an emergency room on the top of the helipad.
Oh, wow.
I don't know if you knew that or not.
No, I
little
did
trivia
not.
there is some of the bigger hospitals actually have an emergency room at the top of the hospital, and when the call comes in, they send a crew
team
up there to do that rather than
Wow.
get that person through the hospital. They've saved minutes
Right.
by treating them up
So
there.
so you're in this rural area then, and you get to the hospital, and they don't even have a neurologist, let's say. Like you said, to a helicopter to transport them, and those initial moments are making such a huge difference.
Yep.
So what are some of the warning signs that people can look for? Because I feel like I want this to, be a resource for people that they could say, okay, this is what everyone should be looking for so that they can help somebody else who potentially has a stroke.
Going to get to that in a second. I wanted to give you one last statistic because there was a question about strokes and age.
Oh, okay.
And fully 1/3 of people hospitalized for strokes were less than 65 years of age. And the question was, why so young? And I think it's diet, lifestyle. The standard American diet, unfortunately, gives us a lot of what we're going to see in a slide or two of the risk factors.
Risk factors, right.
That bring us to that. So we want to put up that fast slide for people to look at while I talk about
The warning signs.
the warning signs. The first one is visual, is a face drooping. You'll see someone's face might droop. They might
And one-sided.
on one, typically just one side for 99% of the cases. Otherwise, they're unconscious more than likely. The person will have trouble understanding you, or they'll be speaking incoherently. They'll have trouble communicating. They'll be confused. If they do get up from whatever they're sitting, because they'll want to sit down, they'll have trouble walking. They may have a painful headache. You may notice weakness in their arm. If you see any of these, call 911. It's worth it. Don't be afraid to call 911.
Yeah.
They're gonna come. They're gonna show up. They're gonna assess the situation with the skills that you may not have, and then be able to go from there. Maybe.
And then if you are in one of these rural areas, like we were saying, for some people, just go. Don't sit at home and wait it out. Take that person to whatever emergency room is close by, even if it's an hour away, because that first 24 hours of trying to stabilize it are so critical. So if you're not in an area where EMS can come and get you, to take that person in.
Yep. Especially if they're feeling numbness. They'll feel it in their face. They'll feel it in their arm and leg, on one side or another. Make sure whoever you talk to, you tell those things to, because remember, this person can't communicate for themselves. Any little piece of information is going to be helpful. You never know what it's going to be.
Right.
I had a case where someone close in my life had experienced those symptoms, and I called a friend of mine, and he has a long experience with in-home care and seniors and stuff like that. And he said, make sure when you talk to the ER nurse, that you make it very clear that this person has had numbness coming down their face. Maybe it's nothing, but you're going to get the care that you need over someone who twisted their ankle.
Right.
So this is a neurological issue. It's a little more important. Let's take advantage of the information and get that person care.
Right.
And then we can stabilize them. That's so important.
So what puts us in general at risk for a stroke?
Okay. We're going to go to the next slide so people can see this while I'm talking about it. This is very big. These are the big risk factors, and I would ask people as we go down this list, think about it. Do you or someone you know fit this criteria?
Right.
Right. Someone who is overweight or obese, right? They don't have to be very much overweight, but it is a factor. Okay. Are they active or not? Are they sitting on the couch every day? Are they getting any exercise at all? Right? Are they a heavy drinker or a binge drinker? Or are they using illicit drugs or cocaine, methamphetamine? to bring this to, let's take that and look at Chinese medicine for a second, right? And what we see a lot in obesity, physical inactivity, and heavy drinking is now this is damaging the blood, right? It's creating a lot of
like heaviness,
stickiness, gooiness in the blood, which, you know, is not a far cry from saying now we have embolisms, right? Now we've got plaques, we've got, you know, occlusions. The arteries are starting to close down,
smaller,
and it makes sense that these are risk factors for a stroke.
Right.
So, and those are lifestyle risk factors, right? So those are things we can change.
Right.
Lose the weight, get some exercise, go for a walk. You know, I always tell patients of mine, I'm not asking you to be an Olympian.
Right.
But walk down to the mailbox. You know?
Right. And then after you've done that a few times, walk down to your neighbor's mailbox.
Walk around the block.
And get to the point where you're walking around the block.
Get things moving, because that nourishes everything.
Right.
Every time you move your muscles, the muscles squeeze the veins and they push blood back into your heart.
Right.
Get circulation going. It sounds like a little thing, but it's a big thing.
Right.
Right. And then you can enjoy a drink if you're doing those things. Okay. Maybe not binge drinking. Not such a good idea.
Right.
But, you know, we want to see you healthy and moving along.
Right.
Okay. Now the other ones really are now secondary conditions caused by things like the first list we went through, right? High blood pressure, exposure, you know, what is cigarette smoking really?
Right.
We're medicating ourselves.
Right.
You know, it's stress.
But it's also creating that
right?
idea that, you know, you're trying to oxygenate the blood, and when you're damaging the lung, it's that transfer of oxygen. The blood isn't getting the same amount of oxygen, so then the tissues don't get as much oxygen, and then you have that clot formation going on.
Right. High cholesterol, right, is another example of this. You know, gooing up the blood, right, or making it all sticky and you know, creating problems in the blood flow.
Which is dietary. I mean, you're talking about what you're putting. Well, in most cases, I have seen some instances where it's congenital, and then the person is on medication, and what they eat isn't making a difference. Back to the blood pressure thing, I think all the time of examples when we were in school, and one of the teachers, Dr. Olga, would say, you know, if a patient tells you I only take my blood pressure medication when I feel like my blood pressure is high, it's like, no, you don't understand. That's not like, unless you're, and I mean, if it's consistently high, you need to take that medication every day. And the way she would say it is that if the blood pressure is high, the blood is slamming through the vessels, and then it creates these little like micro tears. And so the body's response to heal them is to kind of clot around those micro tears, and then more and more attaches to them. And that contributes, like you said, to that narrowing of the vessel. And then, you know, one of those breaks off, and then you have this embolism potential because you have the clot floating. Right. So, don't ever come into a practitioner and say, I'm not taking my blood pressure medication unless I feel like my blood pressure is high.
And then you have diabetes, which has many, many issues with it, right? That brings all sorts of problems to the body, healing,
and
circulation.
I feel like with diabetes, it's not just type 2 diabetes. There is, you know, so type 1 diabetes, for listeners, the patient who has that, their pancreas is not producing any insulin at all, but it still puts them in risk factor categories for having heart attack and stroke, even though it's something beyond their control. Someone who has type 1 diabetes is not necessarily having it because they're eating the wrong thing and because they're overweight or not exercising or.
Right. Yep. The next one is sleep apnea, which I have seen in anyone who's slightly overweight. You can have sleep apnea, okay? Right. And this is a real problem with oxygen levels dropping through the night, and it disrupting sleep, disrupting heart function. It's to me one of those things that people take lightly, or they get a CPAP or something and they don't think much about it, but it has some long-term problems. Yeah. And the last one, cardiovascular disease, as we mentioned in the beginning, heart failure, heart defects are primary indicators for a stroke. Right. And if you were playing along at home and you have 4 or more of these, you are at risk for a stroke. So if you have 5 or 6 of these, you're really at a risk for a stroke.
Right. And you need to start making some changes.
If you know someone, right, a family member, that checks off more than 4 or more of these boxes, you really want to start thinking about getting care for that person. And what's great about the acupuncture that I practice for stroke is actually a preventative also.
Right.
So when I'm evaluating someone, I might notice some of these factors, or I
Right.
might notice some physical factors in my physical assessment of them, and I will let them know, and I will start treating them with the stroke protocol,
Right.
as we call it.
I was sharing this with you when I was looking up different things so that we could have a conversation, because like I said, this is not my specialty, but I wanted to at least be able to converse with you. I had read an article in Neural Regeneration Research Journal that mentioned that in their process of researching acupuncture and its impact post-stroke,
You can take that slide down.
it showed that there was reason to theorize that acupuncture and E-stim, electrical acupuncture, has a preventative and protective effect on cerebral ischemic injury. So there's this idea that we talk about all the time that acupuncture should be considered as a preventative. You don't have to wait until you think that there's something wrong to go and see your acupuncturist. Do it so that you're maintaining your health. You want to catch the body before it goes into a state of unbalance and keep it balanced, because stress comes in and does different things. So, by getting acupuncture regularly, you're at less risk then of getting a stroke because you're trying to live more healthy.
Absolutely.
So I thought that was an interesting,
Yep. How many times has someone come into your office and mentioned that they have high blood pressure?
right.
So you treat it,
Yeah.
and the numbers start coming down.
Right.
And I say, talk to your doctor about weaning off your meds.
Right.
Show them your numbers.
Right.
Have them give me a call. I'm not going to tell you to stop taking your medicine,
Right.
but
But you may
I will
not need
tell
the
you-
same dose either, which it's not good to be
Exactly.
on too high of
Sure.
a dose. So,
Sure. Yep.
so some of the complications, the chief complaints that patients come in with after they've had a stroke. Talk to me about some of that.
The big one is limited mobility.
Okay.
Okay. Walking or being unstable. People have
They're more
people
likely
who,
to fall than if they're not.
fall risk. Even before that is hesitancy, a tentativeness to walking somewhere.
Okay.
Because they need to put their foot up over a curb, and it's almost terrifying for them.
Right.
Imagine being an 89-year-old man, and suddenly you can't walk up, step over a curb.
Right.
It creates a really bad response,
then there's a
stress
fear
response in the body, and then the ability to do that is like a light bulb coming off in their head, to watch them like, wow, I just did that.
Right.
That was pretty good.
And these are all things that when I say this, I should have prefaced it with, these are things that acupuncture is helping with. These are the things that you're helping.
Yep. Painful swallowing, inability to eat solid food, chew.
See, and this was something that in my mind I was thinking difficulty swallowing. It didn't occur to me that because of the nerve sensitivity that happens after a stroke, that it could also be painful for the person to swallow, and not just difficult to swallow.
Yeah, it could be actually painful.
Yeah.
Fine motor skills, right?
Yeah.
The ability to
Pincer grasp.
to pick up a paper clip versus a coffee cup versus a broom handle or something like that.
Dropping things because they can't hold on.
Right. Their ability to grab something and hold something. So what we'll do is we have a grasp meter, and we'll do it beforehand, and they'll get a certain number, and then we'll do a treatment, and it'll do another number, and they can see
That's so cool.
they got more strength from
Right.
that. And that's such a great feedback mechanism to them that they still got it, right? In a way, they still have it. And I do this all the time with all my patients is I say, see, your body can do it. It just needs more help to get you back there. And I'm going to do my part, and you need to do your part to bring us back there, Limited mobility, swallowing, fine motor skills, hand-eye coordination.
Okay.
Right, is practicing. I had a guy, I would have him practice, certain
Finger to
sequences, not just to go from
one
pinky
finger to the
index,
next touching.
but to go back and forth, stuff like that. So
Okay.
that he had to think about it, right? Like I was saying earlier when we had a conversation, walking down a hallway and reciting something
Yeah.
like the alphabet, but skipping every other letter.
Yeah, I see, and you said that, but I'm thinking in my head, I would have a hard time
Start
doing
practicing
that.
now.
I know I'm going to have
This
to
is a way to
practice now,
strengthen,
so I'm like,
strengthen yourself.
hard.
So if anything happens, you'll be ready to go. Right?
And you were saying something about doing math things. Sometimes you do like math.
Well, I'll ask them about something. I'll ask them how long ago something was.
Okay.
I'm trying to stimulate their left side of their brain to think,
Okay.
to function, right? Or I'm asking them to stimulate the right side of their brain, right?
Right.
I'll ask them. I'll tell them some obscure joke and see if
If they get it.
how they're
Like
how
dad
they're-
jokes?
how they're processing it, right? Some really bad pun.
So you have to have a lot of dad jokes in
Yeah.
your repertoire?
Yep,
Okay.
yep. A lot of- whatever it takes, right?
Right.
Self-deprecating humor, right? So I wanted to move on to there was a documentary made, and it followed a U.S. guy from Kentucky who had a stroke, and he wound up going to the hospital in Tianjin to get acupuncture. And the way this all unfolded was at the age of 40, Devin Durth, he was a competitive bodybuilder, and he was health focused. He was driven. In the very beginning of the movie, you see him. He's doing those poses with the bronze skin, and he's just like
So not
a
someone
sculpture.
with a lot of risk factors. That's
You
what's
would-
interesting.
You would think, right? What's on the outside is not necessarily
Right.
what's on the inside, right? Very driven. Always gave 110% of whatever he did. His brother's name was Doug. That's why I said Doug before. And his brother Doug was a movie producer. So he was able to document this whole story. And if you go on Amazon, you can find 9,000 Needles. It's a fantastic movie. Dr. Scher is in it. Well, I'm getting ahead of myself.
So he had the stroke here. He didn't have the stroke in
yep.
China.
He was going to the gym like he does any other day, and suddenly the right side of his body went numb, and his trainer buddy right away said, "What's going on?" And he's like, "I don't know. I don't feel right." Like we've said, got him right to the hospital, but he continued to deteriorate. He was intubated. He was basically paralyzed from the neck down. He had a brainstem stroke. Okay. Couldn't move,
So more
couldn't speak.
back of the head.
Right in the base of the
Base of the skull.
of the brain, right? He wound up in intensive care for 3 weeks. He wasn't moving. He wasn't responding. His vitals were unstable. His heart rate would go up and down. His breathing would go up and down. Blood pressure would go crazy. They got him stabilized, and he started to make progress. He was moving his fingers a little bit. He was responsive, and they moved him to a rehab facility. And here's where he goes into the the American insurance company process.
This is our plan of action
Plan
kind
of
of
action.
thing. Like
There you
this
go.
is as much as we're going to do. Kind of. I hate to say it,
Yeah,
but
and he got a lot of help, but it was 3 months, and he reached his maximum medical improvements, and they said there's really nothing else we can do, and we're not going to pay for it because you've exhausted all of your
Right.
options here. And they knew there was more. Devin himself, his wife, he has 3 kids, didn't want to give up, and at this point he's a quadriplegic. Really, he's in a
Right.
wheelchair. He has slurred speech, and the family realizes, if
and he can't do any activities, right? Like he's
Well,
not
he's-
eating, he's not
he's being fed, he's being clothed, he's being
Right.
put in bed.
an otherwise previously healthy, somewhat healthy 40-year-old person.
So they were looking at $100,000 to $150,000 a month for care for him.
In-home care for him.
to have someone come in and take care of him, possibly have him in a assisted living facility kind of place.
But then when you think of the assisted living, how much one-on-one care are you getting to try and get? I think it's just at that point palliative care.
Right.
It's not so much like we're going to try and get you we're just making you comfortable, I feel like.
Almost. Yeah.
Yeah.
Well, he wasn't having any of that, even though he was,
Right.
a quad at this point, right?
Right.
And his brother went to the American Stroke Association and found a book written by a woman who had been through this treatment in China. And to speed up the story a little bit, is they were able to go to China for 3 months at a fraction of what they would have been spending in the United
Here
States.
for care.
Right. So his community, his church got together. They had a fundraiser, and they raised a bunch of money for him. Probably not all they needed, but they wind up in Tianjin, China, and from the first day, they start assessing him and treating him. He gets acupuncture within hours of arriving at the hospital. He gets herbal soaks for his leg, his knee, gets fire cupping. Electrical stimulation is added to the acupuncture points. They've got needles in his face, his head, his hands, his feet, his arms, his legs. They've got what we call bladder 1 needled, to support
Inside the eye for anyone who's not inside the eye, but inside the corner of the eye.
Yeah, yeah, not into the intraocular area.
Right.
But
this is daily. He's getting treatment daily.
Right. And according to his brother, he was in Tianjin one day and was given more treatment than 1 week back at home.
Wow.
And they were already seeing results. And you see it in the video, in the film.
Right.
They needle his leg. First, they show he can't really lift his leg off the bed.
Okay.
And then they needle his leg, and then he's lifting it off the leg. A little shakily, a little haltingly, but it's the first day.
Right.
And he's going to be there for 3 months.
Right.
He gets assigned an orderly who takes care of his daily needs. And the important takeaway for me from this part, and I think this is what we do as acupuncturists in contradistinction, it's one of my favorite words, to the medical community, is to really understand who this person is and what their needs are,
right,
and what's inside, right? Because this is what's happened, right? Is his body has closed off the outside world from us. He's still in there.
Right.
He's still very clearly making it clear. He wants to go to China.
Right.
He's willing to take this chance. He knows he's got no other options.
Right.
And we just need to get in there and communicate with him, or get him to get him to come out. Right?
Yeah.
And open things up, right? So he has this orderly who's like combing his hair and putting hair gel in and giving him his little faux hawk thing. To me that means so much, right? Rather than, like, as you said, your hair winds up being this like matted mess.
I was in after both surgeries, from the way they, had me positioned, my hair was so knotted that I think it took my mother a half an hour to unknot it. I think she probably wanted to shave my head at that point and get rid of all the hair, but she combed it all out for me, and the hospital didn't do that at all. Right.
So as he improves, he's able to speak haltingly, but he was not speaking before, right?
Right.
And
so he had none at all.
Maybe some kind of yes, no.
Right.
Minimal speech. He couldn't form words more than grunting,
Okay.
really, in the very beginning, right? So at one point he says to his brother, he says, "You haven't lived until you've gotten needles in your tongue." And they do. Like we have points underneath the tongue that we needle, and I've done them to myself. And Kim Filkins and I were partners in our class, so we're needling each other's tongues, and we're laughing as we're doing this because we're terrified. But then we do it and realize it doesn't hurt.
Yeah.
You feel a little pinch and then it's gone, just like any other point in the body.
So kidney 1, for our listeners, is on the bottom of the foot. And I think for the longest time I had such a fear. I don't know why I had such a fear of needling that. Like, why did I think that particular point
They told you
would be so painful? But it's not, and it's so grounding, and it's such a powerful point to needle.
Yeah.
It's the only point on the bottom of the foot.
Right.
Where like reflexology has the whole body is on the
foot.
bottom of the foot.
Yep.
In traditional Asian medicine, there's one, kidney 1 on the bottom of the foot, the bubbling spring where the foot touches the earth. So.
Right. So the other great quote that I got from the movie was one of his caretakers. I'm not sure if she was a doctor or a nurse or something. She said, the Chinese way of helping is from the heart. And all these people, they're going to make the same amount of money every day no matter what they do.
Right.
And to watch him progress and to be present with him was their work, and that was the gift at the same time, was to really help him get better. And as the movie progresses, he's speaking more clearly, he speaks more quickly. He has little intonation that you notice was long gone.
The emotion behind it is coming back.
Yeah, all sorts of little nuances that you may not notice before, right? His ability to walk, right? He needed someone to help him, but he was walking rather than being in a wheelchair. And you can see his face, the structure of his face changed, In the beginning, he had a blank affect, and then the tonicity returned, and you could see that
the change.
The Devin of last year was still there, and of course his sense of humor. They would ask him a question, and it might take 10 seconds for him to get a sentence out, but once he got to that last word, everybody in the room was cracking up because he was being funny about something, looking on the bright side, or being tough. He said a big thing he said was, "How come I'm not walking?" And they said, "This is your situation now. You need to, be stronger. You need to be patient. You need to be all these things." He goes, "It's easy for you to say. How come I'm not walking?" It's just determined. Like you can really see that's who he is. And it was still there with all this that happened.
Right.
But the fact of the matter is, he had a brainstem stroke. He improved greatly, but the odds of coming back to 100%. Were probably never more than 50-50.
Right.
And I think he got back more than 50%.
Right.
Of his function. And on the first year anniversary of his stroke, his brother said to him, "So what do you want to do? Tomorrow's the big day. Do you want to have a barbecue? Do you want to get a cake? Do you just want to hang out in the backyard? What do you want to do?" He goes, "I want to go to the gym." So
that's where they went.
That's where they went. So. Did you want to say anything else about Devin? Before we move on?
He did actually pass
away.
He
did pass away.
He lived for another 6 years, though. Yep. And I truly believe that without the acupuncture component, had they not taken that leap of faith and brought him to China and done the 3 months of care, that he probably would not have made it to that 1 year anniversary. Right. And unfortunately, we don't have a setup like that here in the United States, where someone could spend.
Oh, we do.
Well, now we do, but I feel like back then you didn't have to find someone who was even going to do that, because now you've studied under Dr. Shi, and Clayton has studied under Dr. Shi, but I feel like it definitely gave him, and it wasn't just that he got another 6 years, it was a quality, not just the quantity of 6 years it wasn't just 6 years of laying in bed and getting bed sores and feeling like crap, and he had a better quality during that time. So I feel like that's important to realize, that the difference that acupuncture can make in the quality, not just the quantity of adding those extra years.
And the reason I'm spending so much time on this is because of Clayton Shu and his drive to bring this to the United States, where stroke is really epidemic, is so much of our population is having a stroke and then living a horrible life. Maybe I shouldn't say horrible life, but a life of
less quality than you had before.
A huge deficit in quality, and teaching so many of us to treat people this way and getting some incredible results, which I have in my case studies that we'll get to in a second. But his thing is, we want 100,000 needles, not 9,000. We want 100,000 needles. He teaches me, and I expend 100,000 needles helping all these people. And so does Sandra, and so does Caroline, and so does John Cooker, and Kim Filkins, and all my colleagues around the country.
Yeah, I would think that would be the goal, is to make sure that there's somebody in every single state that could give that quality of care, and that every single person who has a stroke knows that acupuncture can give this benefit. So you have some of your own case studies that you're going to share with us, right? So
the first one is a 55-year-old female who had sort of a minor stroke, compared to Devin Dearth, affecting the left side of her arm and leg. And she had a lot of numbness and tingling and loss of muscle tonicity, okay, and in the face too. And general weakness, okay, for 9 months before she came to me. And the way she came to me was through a referral from someone else who had taken Clayton Shu's classes.
Somewhere else.
In Maryland, I think she's from. And she had a friend up here and said, hey, there's someone real close to you. So, she came in and we did an assessment and came up with a treatment plan of 2 times a week for 4 weeks. And after that, we reevaluated and we switched down to once a week for 15 weeks. And we got interrupted with COVID, but I had her taking some herbal tea, which she loves. She actually just called me today to make sure that it's arriving and it's going to be delivered tomorrow or Wednesday or something like that. And I'll arrange for her to get that, because
so after the bulk of COVID hit, you were able to resume treatment then.
Right. And even then, she came back and she didn't backslide.
Excellent.
She still had just a little bit, like really it was like down to the palm of her hand and the bottom of her foot.
Okay.
The arm was fine, the leg was fine, the face had been resolved long ago, but she really enjoys the tea and she finds that it really does help her. It'll go away.
Now, was that a formula that Clayton recommended, Dr. Shu uses in China, or just?
No, it's a botanical biohacking wind tea is what it's called.
Excellent.
Ironically enough, it's wind tea for wind stroke.
Okay.
So she's doing really great with that. Really simple formula. I think it's a patent, right?
Okay.
And she's doing great.
Very cool.
Yep. She actually wrote up gave me a video testimonial, which I won't play here because I don't want to.
But you have that on your website.
Yeah, it's on my website.
Yeah, so if you visit Rob's
and it's a little
website.
long too. So, all right. The second one was a 45-year-old male who, it turned out, we didn't know this in the beginning, we had worked in the same building at AT&T in my former life.
Oh wow!
And
but it wasn't someone you knew.
I thought I knew him. He was like like the building management people.
Okay.
As opposed to people I would work with, And anyway, he had a kind of a
Again,
stronger.
45 years old though, young. We're not talking about this.
Yes.
Is like what we were saying before. It's not just the old person's. It's
not at all.
45 is young.
So his stroke affected his speech, his swallowing, his gross and fine motor skills. He had trouble walking, stepping up on curbs, stepping up on stairs. He had trouble raising his arm, and you'll see people, they'll kind of try and throw their arm when they can't do that. When
give it some leverage to try and get it
to. Yeah, well, they're trying to communicate. If your arm has ever fallen asleep and you're trying to move it, you kind of know slightly what it feels like to not have control over that appendage.
Right.
So again, an evaluation. I took video of him walking up and down my long hallway, and I could see him listing to the right, and set up a plan of 2 times a week for 10 weeks. After that time, we reevaluated, and he was able to start walking up steps, 1 step at a time. He would bring one leg up, and then he would bring the other leg up. He could have used more treatment, but they elected not to.
Okay.
Because of the cost, really.
Okay.
And that becomes a big problem is, in the United States, healthcare costs, right?
Right.
Because people.
It's always. And you're doing different evaluations so that they can see their progress as well.
Right. Lots of talking about that, and again, lots of questioning. Lots of what are you doing differently from last week?
Right.
What are you able to do now? Let's not forget, you couldn't pick up a coffee cup,
right?
When you started 3 weeks ago, and now you're picking up not only a coffee cup, but you're able to open up a pair of glasses and put them on, or open and close a pen.
Right.
Right.
And you also take video
like
too, though, in your clinic, so that you're videoing at certain reevaluation points, so that they can. You can show them their progress if they,
Yep.
they try and say, well, I don't think it's making a difference. It's like
right,
me with the
right.
cosmetic acupuncture. Well,
Right.
let me just pull up your pictures from when we started. You have video of them,
Right.
like you were saying before, listing to one side when they're going down the hallway, and now they can walk without that happening.
Right.
You have that video proof of that.
Yep. Can we put up slide study 2? Yeah. So, yeah, you need to keep reminding them of that stuff because they're like Devin Durth, right? They're like, how come I'm not walking?
Right.
Right? Why am I not running?
Right.
Reminds me of my friend who he went to the ER because he had a nail gun and he put these 3 fingers together with a nail gun, and the guy said, we're gonna pull it out, we're gonna clip the end of it, we're gonna keep going through, and he said, will I be able to play piano? And the guy said, yeah. He goes, well, that's amazing because I couldn't play before. So anyway.
So when I was in school, we the extent of my exposure to neurological when it comes to stroke was doing scalp treatments where you were threading the needles into points in the scalp and lines on the scalp. But you were saying that this technique is very different from that, and that you're treating, the whole body and focusing on the different symptoms and not just those scalp points.
Right. And we do use the scalp points, but we don't limit ourselves to using
That's what I mean,
the
limiting
scalp points.
to the scalp points.
Sure. Because there are a lot of points on the scalp, and they're related to the gallbladder line, and the gallbladder line is related to the whole, flank of the body. So there's that reason there, and there's a number of other reasons I won't delve into. We're looking a little short on time. But we use the scalp points. We use them kind of differently, though.
Okay.
It's more like a gallbladder
Okay.
point kind of thing, and they're threaded this way versus
To send the energy this way.
threaded. Yeah, well, all right.
For those who hear this
Things
on
are
the
getting excited
recorded-
here at the Practical Medicine Podcast, contact sport. So let's finish up with this this guy, Mr. C, I'll call him. His speaking was still difficult, but it did improve.
Okay.
His speech was probably the hardest part of this one. I think he might have had a stutter
Okay.
beforehand.
Okay.
They didn't want to talk much about that.
Interesting.
But like I have here, I'll usually do a video on a periodic basis to show them progress. Not just at the beginning and the end, but also in the middle.
And
Just
not
to
at every
give
visit,
them-
because I'm thinking
No.
subtleties. Like if you were
Right.
doing 10 treatments and you take a video at every one,
Right.
you're not really seeing. Versus if you take it at the first one, 5, and then 10, so that it's kind of like the halfway of the initial treatment plan.
Right. Yeah, you don't want to do it too often because then expectations are that things will always change.
Right.
And it's not a straight line.
Right.
So moving on to more general, like we said, we were talking about scalp. It's focused on really the whole body, right? If they're experiencing a leg issue, we're gonna do treatments along the sacrum, along the back of the leg.
A lot of spinal points.
Not really,
Okay.
except for in the cervical spine.
Okay.
Okay, because of the brain stem
Okay.
and its relation to the rest of the brain, right?
Okay.
But
Distal points too.
a lot of ankle points
Okay.
for any kind of drop foot type
Issues.
paralysis. Yeah.
Okay.
You'll see if you watch 9,000 Needles, they'll go all the way through. They don't pop out the other side, but you can see a little bump there. And he really responded to it. And the next thing you know, he's moving his foot where his whole leg was paralyzed before. And it's just amazing to watch,
And like we talked about I think in the very first podcast, you could have 10 people who come in with stroke. All those 10 people are not getting the same exact treatment. It's specific to what they have going on.
Right.
So that's the other thing that is, where a Western medication for something is just all 10 of you are going to get the same drug. all 10 patients are not going to get the same exact treatment. So it's customized to what they have going on and what they're presenting with for
Exactly. You know, and there's a core
Right.
of
No, I
things,
get that.
but there'll
Right.
be variations, and some of it might be delved into more deeply than other parts.
Right.
You know, so actually, in my notes, I have a whole different system to record that because
Okay.
it's, you know, I know I'm going to do
10,
maybe
whatever.
of the 30 things I might do, I'm going to do 7 of them for you and 14 of them for someone else, and there's going to be an overlap of 3 or 5 or something like
Right.
that. It doesn't, you know, it's unimportant. It just makes it easier for me to keep track
Right.
of those things, you know. And a big part of what we do is, you know, and the great examples are in that movie, is how exactly we needle, you know. It's not cookie cutter. You can't run a video and go, oh, I'll just do what that guy does.
Okay.
This is hours of training with someone like Dr. Clayton Shue,
Right.
exactly how to needle this particular point.
Yeah.
And you say, wow, TCM doesn't do that at all. That's different.
Right.
Why are you doing it that way? And here's the reason. You know, there's slides that will
Explain why you're doing
exactly
each thing
why.
with each point.
You know, and they're coming from China. They're not made up
Right.
by Dr. Shue. Dr.
Yeah.
Shue made up. They're were designed by Dr. Shue.
Right.
You know, a big part of it is communicating with patients, right? Asking lots of questions, really connecting with them. Gentle touch, right? Your hand on their shoulder, look in the eye, you know, to let them know, like, you're not really talking to their caregiver, you're talking to
Right.
them. You know, it's very important that you establish a connection with that person,
Right.
you know, because that's who you're working with. And we tend to look to the person who's interpreting.
Like we're asking them to ask the questions, and you're right. Like make them feel like they're a part of it.
Yeah.
So
Home care, homework, home
yeah, what
care.
do you do at home for them?
I always advocate for a anti-inflammatory diet.
Okay.
I'm going to put up a little link in the chat box for that, because I think, you know, the last thing they need is more inflammation in their body.
Right. And usually most anti-inflammatory diets are generally more healthy than, you know, I love my fried foods. We go through a lot of olive oil in my house. You know, like I don't have bread anymore, but I used to, you know, dip the bread in olive oil all the time. So most anti-inflammatory diets are, you know, eliminating sometimes things like gluten, which even if you don't have an issue with gluten, can create more inflammation for people.
Right. A big thing is if they can get massages for the patient. I really advocate for a professional massage. It's nice to have a family member do that. You know, if you're on a, you know, you're worried about budgets and stuff.
Right.
But a competent massage therapist who knows about stroke knows what to massage and what not to massage.
Right.
Right. We don't want to create a problem where there isn't one.
Right.
Now, you know,
And
we
some
already
people
have a
might be
problem
afraid
now.
of that as massage
Sure.
therapists. So a massage therapist that's trained
Yes.
more in that is going to be more adept and realize that the
Right.
benefits of it. Like when we were chatting and you were talking about how the foot massage aspect of it, like just to have your feet massaged at the end of the day feels so amazing.
Right.
Or even your hands, just the hands massaged feels so fantastic.
Right. Yep. Very important.
I mean, as a former massage therapist, I'm never going to tell people not
Right,
to get
right.
massage.
Yeah.
My roots are
Yeah.
are heavily linked to massage therapy, so
Right,
I always, you know, I feel like I advocate for everyone to have a massage. Everyone should get a massage.
I encourage
Just
that.
like I think everyone should get acupuncture.
Right. And light exercise
Okay.
with that, right? Is even
So
if
no marathons?
no marathons, if they are able to walk, continue to walk, right? You know, anything that they can do, try to do, you know, a little bit each day. Very light. I'm big on low impact. Right?
Okay.
I'll tell a lot of my patients to do some light stretching. Pick a song they like, and then pick a position they like, you know, bend in one leg over the other to stretch their low back,
Okay.
and just hang out for 3 minutes listening to their song.
Yeah.
You know, if it's twice as long, stop. You know, swap over in the middle and do the other side.
Right.
But relax and breathe into that stretch the
Right.
whole time, which brings us to the next one, breathing exercises. Especially someone with a stroke who might be chair bound, is to breathe and strengthen their lungs. I have video instructions that I can point people to.
Okay.
It's usually a subscription service
On your website, you have that.
on my website,
Yeah.
where you pay one price and you've got these instructions forever. You can share them with your friend if you want. It is nice to pay the practitioner who put in all the time to develop these,
Right.
because they really are more than just breathe deep, feel your belly
Right.
kind of thing. It's a lot about Chinese medicine, building Wei Qi, your protective Qi,
Right.
nourishing your spirit, the Shen in Chinese
Right.
medicine, and things like that. So, very important for someone who's really homebound and waiting
Right.
from one treatment to another to get better.
Right.
These are the little things you can do that are going to make all those other things, like physical therapy, massage, acupuncture, occupational therapy,
Right.
a speech therapist. You're going to make those things more beneficial. You're going to benefit
Right.
much more from them by doing these
Greater
little
impact.
little things. Right.
Right.
Yep.
Do a lot of the family members come in and get treated simultaneously?
I was just going to say that is a brilliant idea. It's so necessary, right? In the case of Devin, we've got, a 110-pound wife trying to hustle this 210-pound, 220-pound man,
Right.
who's dead weight, around the bed, the house, the bathroom, whatever. It's devastating.
Right.
Like, she really couldn't do it. That's why they were looking at, in-home care. And that's just the physical part, right? There's the
Right.
emotional toll,
Yes.
the spiritual toll, the psychological toll.
Right.
So for them to get care is almost as important, right?
Right.
How can you help shuttle this other person to and from all these offices for care and not take care of yourself?
Right.
You're going to get sick.
And in a lot of cases, the person who's had the stroke has to have someone else, their caregiver is bringing them. So if they're there, I'm thinking even if they just did like the auricular protocol just for stress relief, so that, they're laying on the table while you're, doing the other things, that how beneficial that is. And I mean, we'll probably do a whole other podcast on self-care and care for the caregiver. But I know, like in this situation, my dad hadn't had a stroke, but with his MS. So my dad was 6'2" and my mother was 5'2". My mother is probably still only 110 pounds soaking wet.
Right.
And there were times when, if my dad fell, it was a huge effort to pick him up. Eventually they had a Hoyer lift that they could, lift him up with. But I think that we don't always talk about the, like you said, the psychological and the impact that it has on the caregiver. They are often left to the wayside.
Yep.
So.
And my experience has been a lot of those people will say, oh, no, not me. You got to take care of that person.
Right. But that goes back to that cliche of, if you're in the plane and the oxygen mask comes down, you
Exactly.
still have to put yours on first before you help anybody else on the plane. And
Exactly.
if you're
not going to be able to.
Yeah, if you're
Right.
not taking care of yourself and the stress that the other person, having this going on, then you're not going to be able to care. And your tension level rises, like, no matter how much you want to pretend that, it's easy, it's not. And the stress level of it wears on you after time.
Exactly. So one of the things I have developed in my office is a low-cost treatment where I don't diagnose them. I give them some ear points
Right.
that downregulate the nervous system, reduce stress, support their liver, kidney, heart,
Right.
Right.
All the things that get stressed.
all the things that get stressed, and also the nervous system, right? So that they get a wonderful treatment, and they benefit
quick
so
and
well from
easy.
it, and it's
Yeah.
quick and easy, and it's at a price point that's
Right.
easier for them to get their head around.
Right.
In a nutshell,
So did we have any questions from anybody in the audience?
I think we may have covered them.
Okay. Just want to make sure if there
Mm-hmm.
were. Okay.
Do you see any, Ming?
Just a lot of comments.
Just
Daryl,
comments.
Yeah, Daryl Thoroff, massage therapist can help teach caregivers some techniques to do at home between massage sessions as
Right.
well.
Yeah.
Yeah. Hillary Balko. Hi, hello, first time caller. Do you have a list of warning signs to look for when you suspect someone might be having a stroke?
Oh, I think someone missed a slide.
And we can list those underneath the podcast as
Sure,
well.
sure.
Like a quick and easy.
Yeah, we can.
This is how
actually,
you
can
know.
put up the fast slide.
Yeah.
There are a
Add
those
those
slides
to
that
things.
talk about that. Basically, diabetes, overweight, high blood pressure. It'll be like a quiz. What do people remember? What
No,
can
I
you
think she
say?
was thinking of the warning signs to look for.
Oh, the fast.
The fast, yeah, the
That's-
face
that's what I was-
dropping.
That's what I was thinking.
That quick
Drooping face, numb in the arm.
speech difficulty and,
Right.
and just to as quick as you can call 911. Those are great points to reiterate anyway.
Yeah, that's as far as anybody's concerned. If there's anything you take away from it, it's that slide right
Yeah,
there.
the fast slide.
Is if you see somebody struggling,
Better
just
safe than
popped into my
sorry.
head a story. One of my old managers back at AT&T days was jogging down the street, and he was passing another guy. Was coming his way. It was springtime. People were starting to get out, and the weather's a little better. And here was this man huffing and puffing, clearly overweight, jogging, and my boss turned around to head back the other way, and there he was laying in the street.
Oh my gosh.
And this is back in the day when you didn't have a cell phone. He ran up to the first house
Right.
and had him call 911, went back to him, and started doing CPR on the guy.
Yeah.
You never know when you might be in a situation where you can change a life.
Right.
You know.
Right. So, if we don't have any other questions, our next podcast will be in 2 weeks on November 16th, and we're going to broadly start covering gynecology and acupuncture. It's when I say broadly, there's so many subcategories that I'm sure we will have to do individual podcasts about, like just as an example, endometriosis alone, I think I could probably talk about that for 2 hours, but we're just going to start broadly covering how acupuncture can help with a number of gynecological conditions, what normal periods look like, and the different, whether it's acupuncture and herbs and how it can help and things that people can do at home.
Just the notion of normal,
Yes.
I find, is a fascinating topic. When you
Yes.
talk to, I'll have a patient bring in a teenager. Oh, let me bring my daughter in, something like that. And they say, I said, do you have headaches? And they say, oh, normal.
Yeah, that's not normal.
So we'll save the rest of that story for
Yes.
next time.
So
But,
we just want to remind everyone to like us on Facebook. We each have our individual Facebook business pages and Instagram pages. All that stuff is listed underneath. So, Dr. Rob and I both have YouTube channels that you can subscribe to. While I have not uploaded our podcast to it yet, the Practical Medicine Podcast has its own YouTube channel that eventually everything will be uploaded there. So we will see you guys in a couple of weeks. Thank you, Ming, for taking care of everything for us, and stay healthy, and thanks for listening.
Thank you. The contents presented during the Practical Medicine podcast include information about various modalities that exist to achieve health and wellness and are for informational purposes only. You acknowledge and agree that the following disclaimers and warnings shall apply to all content presented.
The podcast contains the opinions of Dr. Robert Balko, DAC, LAC, and Dr. Stephanie Lipnicki, DACM, LAC, and the guests of their show. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you have regarding any medical condition.
The views expressed in the Practical Medicine podcast are our own and do not represent those of all licensed acupuncture professionals. Always seek the help of your own acupuncturist or medical provider to determine your best course of action. You may want to use the information presented as a supplement to better understand your diagnosis or treatment, but it should not be the sole thing that you use to make important medical decisions. Do not use the content of the podcast in lieu of medical advice.
Never disregard professional medical advice or delay seeking care because of something you have heard on this podcast. Privacy is important to us, thus all people, places, and scenarios have been changed where applicable to protect privacy and maintain confidentiality.